Well, we see a lot of diabetics in my practice. It's probably about 50% of our practice, and the statistics are striking. I took engineering calculus in college, so I can tell you that statistics usually fascinates me. And there are about 70,000 diabetic amputations a year in this country. And about 60,000 non-diabetic amputations. And unfortunately, 90% of those diabetic amputations can be prevented. So unfortunately, most of the time in my practice, if I get a call from the emergency room, it's usually a diabetic that needs some kind of an amputation, partial amputation. And most of the patients that actually come and see us on a regular basis every 10 weeks, we really rarely ever have to amputate because they see us, we take care of them, we assess their risk factors, and basically maybe 1 or 2 times a year I actually have to amputate somebody who is an existing patient. So statistics in my practice is striking as well. It is definitely a proof that going and seeing a podiatrist 5 times a year can make a difference of a lifetime. Well, I mean, a regular amputation that I see in my practice that is from the emergency room, you're looking at staying in the hospital for several weeks. You're looking at intravenous antibiotics to get rid of bone infection. It's extremely costly, about $60,000 it costs to amputate somebody's foot. And the most unfortunate statistics is that within 2 years, 40% of those patients die. So bottom line is, if I was a diabetic and I heard that statistics, I would have dedicated 5 visits a year to go and see my podiatrist instead of considering a huge bill from the hospital and missing part of my foot and taking a 40% chance of actually dying from an amputation. Americans have no idea that peripheral arterial disease is the #1 killer. You know, breast cancer, I'm a woman, so of course I go to all the runs, and you know, breast cancer is such a big deal in the United States. As a woman, I have a higher chance of dying of peripheral arterial disease, not even being a diabetic, than breast cancer. So when we see a diabetic in our office, we're not very typical podiatrists. We don't just cut your nails and tell you to come back in 9 weeks. Absolutely not. If this is the only type of care you need or you want, you should not see us. We are there to basically assess your risk factors, just like if you go to a cardiologist to assess the risk factors for your heart disease. We will run tests that will include tests for circulation. It is called an arterial Doppler to see if there is any blockage in your arteries. And people ask me, well, why do you do it? I mean, I don't really have any severe problems. I have some cramping once in a while. Well, bottom line is medicine moves forward all the time. So if we assess your risk factors and we see that there is blockage in your artery, but it's only 40% or 50%, I will refer you to a vascular surgeon. And there will be a next test that will be done by a vascular surgeon to assess the percentage of blockage and where the blockage is, whether it's below the knee, above the knee, and whether there is a procedure that is minimally invasive procedure done overnight at the hospital that needs to be done. Well, if you're not my patient, then what happens is you wait until that blockage is 100% and then you're out of luck. You cannot have this simple minimally invasive procedure. You will need to have a bypass surgery, about 3 weeks of hospitalization and a major incision from the groin to the ankle. So if you have a choice, I think I would go with the first one. So bottom line is, as a diabetic, you have to see a podiatrist, or you're looking at some major complications further on in your life. The other thing that I do want to mention is that we're the only practice in Polk County that performs a new procedure called Dellen decompression surgery, where we decompress 3 nerves for painful peripheral neuropathy if it does not respond to conservative treatment like medications, anodyne therapy. Basically, it is extremely successful. There is an 85% success rate with treating painful neuropathy with this procedure. So I highly recommend people who have neuropathy and they have tried everything in the world to try to treat it and they still cannot sleep at night because of the burning, they need to see us. We actually have a test in the office that is called PSSD, that is designed by Dr. Dellin, who is a plastic surgeon out of Johns Hopkins, and me and one of my partners, Dr. Galina. We did a fellowship in peripheral nerve surgery with Dr. Dellin, and we do the surgery to decompress the nerves. Patients walk right out of the operating room. It's extremely successful, about 85% success rate. So guess what? You can sit on your diabetes and do nothing about it, and it's like a time bomb ready to explode, or you can see us and we can help you.